everyone, welcome back to my channel. In today's video, we are going to study about CPT modifiers. This is going to be part 1. So the modifiers covered in this video will be modifier 22, modifier 23, 24, 25, 26, 32, 47 and 50. So all these modifiers will be covered in this video. Before starting, don't forget to hit the like button, share and subscribe to my channel CodeMed Mastery. First, let us start with the introduction. So what are CPT modifiers? CPT modifiers are additional 2-digit numeric codes that you attach to CPT, that is current procedural terminology codes. So why do we append modifiers? Modifiers are appended to report specific circumstances or alterations to a procedure or service without changing the definition of the code. Modifiers provide extra information about the services and procedures performed by healthcare providers. This helps insurance companies and other payers understand the specifics of the service, ensuring accurate billing and reimbursement. So, appending modifiers is very important for the payers to understand specifics of the service so that it ensures accurate billing and reimbursement. So where do we find the list of CPT modifiers? In your CPT manual, Appendix A. Let's start with the first modifier for today, that is modifier 22. Modifier 22 is used to indicate increased procedural service. It signifies that the work required to perform a procedure was substantially greater than typically required. It simply means that the physician performed extra work due to complications or unusual circumstances. So the example of modifier 22 is if a surgeon is performing routine appendectomy but encounters severe inflammation that requires additional time and effort to complete the surgery. So in this scenario, there is additional time and effort to complete the surgery. Therefore, we should append modifier 22 to the procedure code, that is to the CPT code. Now let us see the keywords for modifier 22. The keywords are extra work, took longer than normal, additional time, substantial additional work. So all these are the keywords to identify whether or not you need to append modifier 22. Let us move on to modifier 23. Modifier 23 is used to indicate unusual anesthesia. So when it is appended when a procedure that typically does not require anesthesia, or it would require local or no anesthesia. But due to some circumstances, the procedure required general anesthesia. Therefore, we need to append modifier 23. That is, the procedure required general anesthesia due to unusual circumstances. For example, if a patient with severe anxiety or uncooperative pediatric patient requires general anesthesia for a minor procedure. It means that the minor procedure usually requires local anesthesia. But if the patient has severe anxiety or an uncooperative patient is present, then it requires general anesthesia for a minor procedure. Therefore, the physician would use modifier 23 to indicate the need for unusual anesthesia. Let us see the keywords. The keywords are unable to tolerate without general anesthesia. Next modifier 24. It is used to indicate unrelated E&M service by the same physician during post-operative period. It signifies that E&M service performed was for a condition that is entirely unrelated to the original procedure. For example, if a patient had surgery and is in the post-operative period for that surgery, but he visits the same physician for an unrelated issue like an ear infection, then the physician would use modifier 24 for the E&M service related to the ear infection. Let us check the keywords. The keywords are unrelated, not related to, or unrelated E&M service. I am providing the keywords so that it's very easy for you to understand. Next modifier 25. Modifier 25 is for significant separately identifiable E&M service by the same physician on the same day of the procedure or other service. It means that E&M service provided is distinct from any procedure performed on the same day. For example, a patient comes in for a routine follow-up visit. During the visit, the physician identifies and treats an new issue, okay, which is unrelated, for example, ear infection. Then the physician would use Modifier 25 to bill for the separate E&M service alongside the routine follow-up procedure. So the keywords are separate E&M service outside of unrelated. Next modifier is 26. This is a very important modifier. Modifier 26 is used to indicate professional component of a service. It means that physician provided interpretation, supervision or written report for a test or procedure. Please take notes. Okay. So this means that the physician provided interpretation, supervision, written report for a test, but he did not perform actual technical part of the service. The physician only provided interpretation, supervision or written report for a test or procedure. Let us see the example. If a radiologist interprets an X-ray taken at a hospital, the radiologist would use Modifier 26 to bill for the professional interpretation only, while the hospital bills for the technical component for taking the X-ray. So in this case, the radiologist is interpreting the X-ray. Therefore, he would use Modifier 26 to bill for the professional component. Second example, if a cardiologist interprets an ECG, that is electrocardiogram, that was performed by a technician. So here we will give CPT code 93000, that is for ECG. Okay, and it will be coded as 93000 with Modifier 26 for the professional interpretation, because here the cardiologist is interpreting the ECG. Okay, therefore we have to append Modifier 26. Let us see the keywords. The keywords are professional component, independent radiologist, physician review interpretation, performed in the hospital, physician owns. Let us see when to not use Modifier 26. Modifier 26 should not be used when the service provided involves both the technical and professional component. For example, a radiologist in a private practice takes and interprets an X-ray in their office. So in this case, we will not use Modifier 26. Why? Because the radiologist is performing both the technical component, that is taking the X-ray, and he is also performing professional component, that is interpreting the X-ray. So there is no need to indicate just the professional component. In this case, the CPT code would be built without Modifier 26 to represent the complete service provided. Next, Modifier 32. Modifier 32 is for mandated service. So it is used to indicate that the service was provided due to a mandate from a third party, such as insurer or government agency. This modifier is used to show that the service was not initiated by the patient or physician, but it was required by an external entity. For example, an insurer requests an independent evaluation of a patient filing a workers' compensation claim. The physician performs the evaluation and uses Modifier 32 to indicate that the service was mandated by the insurer, because in this case the insurer is requesting independent evaluation of a patient. Okay, let us see the keywords. The keywords are required by insurance or third party request. Next, Modifier 47. Modifier 47 is used to indicate anesthesia by surgeon. Okay, this modifier is applied when the surgeon administers regional or general anesthesia during a procedure instead of having a separate anesthesia provider. So it simply means that the anesthesia is given by the surgeon. For example, during a minor surgical procedure, the surgeon administers nerve block to manage pain. So what is a nerve block? A nerve block is a medical procedure where anesthetic or anti-inflammatory medication is injected near a specific nerve or group of nerves to block pain signals. So in this example, during a minor surgical procedure, the surgeon administers nerve block to manage pain. That's why surgeon is using Modifier 47 to indicate that they provided the anesthesia. Let us see the keywords. The keywords are surgeon administered anesthesia and also anesthesiologist not available. Next modifier, modifier 50. Modifier 50 is a very common modifier often used. So it is used to indicate a bilateral procedure, meaning the procedure was performed on both sides of the body, that is left and right. It is important to use this modifier correctly to ensure proper billing and reimbursement. For example, if a patient undergoes bilateral mastectomy, then the surgeon would use modifier 50 with the procedure code to indicate that the procedure was performed on both sides. Let us check the keywords. The keywords are both sides, left and right, and bilateral. So that's it for today. Thanks for watching. In the next video, we will cover part 2 of modifiers, that is from modifier 51 to 59.